This week here in Kerugoya, ACK, Kenya, African Center for Endometriosis, in collaboration with this institution, we are running a 2-day laparoscopy camp. And basically what we are doing is patients who have gynecological condition that would require to have surgery, and we are providing them with minimal invasive surgery, which we consider as laparoscopy. More than just offering these surgical procedures, we are also training other doctors and we are learning from each other. So it's a really exciting collaboration which focuses on enhancing and improving our quality of care to our patients, especially in surgical field.
This is really the first time that I've really been able to do a deep dive into minimally invasive surgery. The resources here are absolutely amazing, specifically for Kenya. The skills and the teaching environment here is going to have a global impact. He's training physicians who are going to go out into the world and really do some really big things.
My experiences here so far have surpassed my expectations. I've been able to join him both in Maple Grove, here in Kerugoya, in the OR and clinic, as well as in Nairobi in Third Park. And I've been thoroughly impressed by the level of care that they provide endometriosis patients, and especially here in Kerugoya in the rural area. As many of us GYNs know, there is a misconception about endometriosis in Africa. A lot of data shows that the prevalence is low in Africa and the morbidity is low. And people who practice endometriosis care in Africa know that that is false. And so it's very inspiring to see that Dr. Njagi has taken on this part of women's health and has chosen to really dig into it, provide excellent care to the patients, and also spread knowledge about the realities of endometriosis here in Kenya and in Africa.
When we talk about endometriosis, we still find that there's a lot of misinformation or lack of information, to say, in the community. And the reason is because there's not been enough sensitization on this condition, endometriosis. 1 out of 10 women, that is 10% of women who are in their reproductive age, would be found to suffer from endometriosis. So we need to start talking about it, and we need to start educating young girls and women, and just passing the message that painful menstrual period pain is not normal, should not be normalized.
You have women during their menses have excruciating pain, and because of perception, because of family member influence, because of friends' influence, they feel like it is normal to have excruciating pain during their period, which it is not, ideally. So if you have a lot of pain during your periods, please seek a healthcare's opinion on your condition, because you could be having endometriosis.
I think if there was something that I would want to add to this program is additional resources. In the United States, we have access to robots. I'm robotically trained. I also do laparoscopic surgery. But they are able to do amazing things with minimal resources. So if we can potentially provide them with additional resources, instruments, gloves, gowns, whatever it is, and also teaching resources, I think that they would be able to make an even larger impact globally.
The skills I've gained since the last 6 months being with him have been quite immense, both in adding my personal skills in laparoscopy and helping my patients even in London.
March is a month set aside for, it's an endometriosis month. And I feel that much that we should do in this month is to create awareness of endometriosis. We actually have been, and we still continue to be, on the forefront of advocating and talking and creating an awareness for endometriosis, more than just training and offering services. Because we feel with education awareness, then people are able to make appropriate decisions for their health. And with more education, then we find that the health-seeking behavior for patients who have symptoms that will be suggestive of this condition, then definitely going to improve.